Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Exactly. So what we do each and every day is we don't just treat fertility. We want to see what's the underlying condition. So if it's PCOS, PCOS is not something that you treat and wait to treat when you're trying to get pregnant. I mean, we see patients that, they come in at 36 and we are the first people to talk to them about their PCOS. Whereas if they had started treatment, let's say in their early 20s, they wouldn't have all the symptoms that they would have today. Let's say, high cholesterol, high BMI, just to name a few things.
Right.
So other things to pay attention to: high blood pressure, high blood sugar. We don't like to use the word fat.
No.
We like to use the word curvy.
Curvy.
And abnormal cholesterol levels. So these are all things that you can talk to your doctor about. And then if you feel like you're not getting the help that you need, find someone that you think will listen to you always. So a lot of celebrities in fertility in the news.
Yes, a lot of them have frozen their eggs, and recently they're coming out and talking about it, spreading the news. Like Olivia Munn, she said she froze her eggs, and she found out about it when one of her friends was undergoing testing.
Right.
They were at the same age, probably in their early 30s maybe, and her friend was told, you have the ovaries of a 50-year-old.
Yeah, that's not depressing. No, that's very depressing. I mean, and that's the thing. When you get your fertility levels checked, it isn't like getting your blood sugar checked. When you get your blood sugar checked, there's always something that you can do to make it better. But when you get a fertility level checked, it's not like you can go to the gym and work out and it's going to get better. So we want to promote awareness, understanding at your levels at an earlier age. So she was quoted when she froze her eggs as saying, to me, parenting is the most difficult job in the entire world. And when I want to do it, I want to be committed and 100% ready to take on and be the best mom I can be. At that time, she wasn't in that position. But I actually think I saw in some headline that she got married or engaged or something like that.
She's dating
someone.
I don't know. We can ask TMZ. But that was Maria Menounos.
Oh, that's right.
Yes.
That's right. So you hear egg freezing being referred to as insurance. I mean, is it really insurance? No. There's no such thing. We're talking about human biology. An egg does not equal a baby. An egg equals a chance for pregnancy, and you should know what your chances are before you go into it. And we'll be talking about that way more every Wednesday night here, and we're here to answer your questions. If you have a fertility story you want to share with us, you can go to the website, eggwhisper.com/show. The phone number is right there. You can call in even right now, and we'll listen to your story and see what we can do to help. So several celebrities have been public.
Yes, about their IVF and their fertility struggles.
Yeah.
Jimmy Fallon, for one, he and his wife tried for 5 years until they were able to conceive and have their daughters, I believe, 2 daughters, through, I believe, a surrogate.
And something that I was reading recently about Brooke Shields, I think she had over 5 IVF cycles before she had her 2 kids.
Right.
And even Nicole Kidman, we know that story well,
Yes.
as well as Chrissy Teigen and John Legend. And recently she came out talking about postpartum depression. And when you've gone through fertility treatment, you almost feel guilty for feeling depressed because it's like you worked so hard to have this pregnancy.
Right.
And then you're feeling sad, and I can only imagine how hard that must be. But I think it's helpful for people to talk about it so people realize that they're not alone in this. And then the biggest headline, and people joke with this all the time, is the whole 3-person IVF. And it's really not 3-person or 3-parent, and we don't mean a menage a trois. Although when you talk about 3-person, sometimes their minds go to different places. So the mitochondria of a cell is the battery pack, so to speak,
powerhouse of the cell.
Yeah. And so recently we heard of a live birth in Mexico. It wasn't the first live birth from 3-parent IVF, and it seems like the next live birth might be in the UK.
Right. The first live birth, they took this couple down to Mexico, a doctor from New York, I believe, and they did the first 3-person baby.
Yeah.
And
Most recently.
The baby was born, I believe, April 2016.
Right. So who knows what this might mean for, let's say, older moms, but for sure this will help people with mitochondrial DNA disease. But just to educate you a little bit about, that's just a cute imagery of the the batteries. But just a little bit of education of the 3-parent. Basically, it's a nuclear swap out. So you have a cell, so you just remember biology. You take the nucleus out, and then you transfer it with the nucleus of the parent. So you take the egg donor's egg, you take her nucleus out, mitochondria stays, and then you put in the nucleus of the parent. And I love the analogy that you came up with, that it's like you have a really good functioning company, but they're in an old building. You just take the company out and put them in a new building.
In a new building, modern, Wi-Fi, high-tech, and you're ready to go.
Ready to go. So that's kind of something to look forward to as an exciting new breakthrough. So, aside from those fertility trends this week, I mean, what I thought we could talk about are just fertility diagnostic tests.
Sure, yes.
And there are a number of tests that we do for patients who are coming to see us for the first time. Some patients haven't had these tests done yet. And so it takes 3 things to have a baby. Patients hear me saying that all the time, but if you're not my patient, you wouldn't know that. So we want you to know everything that you can possibly know to give yourself the best chance for pregnancy. So it takes 3 things to have a baby: egg, sperm, and fallopian tubes that are open. And so your fertility is not skin deep, right? It doesn't matter how great you look on the outside. Even having regular cycles doesn't mean that you have normal fertility levels. And a lot of women take birth control pills until they're ready to start a family. And birth control pills can mask infertility. And so we strongly suggest that women get their levels checked, even when you're not trying to get pregnant. But if you get your levels checked earlier, you may make decisions for yourself that you may not have made.
Totally.
Like egg freezing or starting a family earlier. I'll just give you one scenario. So let's say you have a baby and you're not ready for baby number 2, and you wait 3 to 4 years for baby number 2. If you hadn't checked your levels, you may have thought that you could wait.
Right.
And you really shouldn't have. So the 3 levels are FSH hormone, estradiol hormone, and anti-Mullerian hormone. And the FSH estradiol sometimes confuses people because it has to be done in the beginning of a cycle.
Of your period.
Yep. So if you go to Google Image and just put menstrual hormones during the cycle and just click image, you'll just see a graph. And there's a reason why we check those levels at the very beginning of the cycle. And it's because they're at their lowest. So when they're at their lowest, they give us a good idea as to what's going on with your eggs. Okay. And then FSH level goes up, so does LH around ovulation. So when you get a snapshot at the very beginning of the cycle, you get a good idea as to what's going on. And then you can watch those levels over time. So let's say you do one snapshot and something is kind of off with either one of the hormones. You can then repeat the level maybe 2-3 months later, kind of see what's going on. So you kind of see what the trends are, and you can see what's going on with your eggs. And then AMH, we also call it
always meandering hormone.
That's true. It does go up a little bit. It can respond to birth control pills. It goes down maybe 10-20%. It responds, it changes with, let's say, vitamin D deficiency. So with AMH hormone, you can check that any time of your cycle. So if you come in as a new patient, we will check your AMH levels that day, and we can get them back within 2 to 3 business days, and we'll find out more about your fertility. So that's kind of that part of the egg stuff, but you can also look at an ovary.
Yes.
And that's kind of what we do every day.
Yes, they're beautiful.
They are
I
beautiful.
love looking
And
at
we
ovaries.
say beautiful a lot.
They are. We tell our patients you have beautiful ovaries.
It's true. And a beautiful uterus.
And beautiful
Gorgeous.
uterus.
Yes. So we count up the little black circles on the ovary, and those are called follicles. And that number together with the hormone levels, the FSH, estradiol, AMH, they tell us about your fertile potential. And then they kind of guide us as to what kinds of things you should be thinking about.
Right.
But every egg cell needs a sperm, right? So if we don't know about the sperm, you can't assume that the sperm's normal.
No,
right?
I think that's coming up in the news about men and fertility and sperm issues.
Exactly. I mean, what was I going to say? I was going to say that George Clooney, he just cracks me up. Every single headline, and the latest one is about, he's 55 and then changes his mind about wanting a pregnancy. But if only women were that lucky.
Only.
And if only we were so lucky that we could just put our eggs in a cup.
I know.
And someone can look at it and freeze them that way. But,
right. I can look at Ryan Reynolds and be like, oh, here's a batch of eggs.
Right. Exactly. But for us, a guy has to, or guys, not us, men have to collect a sperm sample. And just looking at the sperm quality, and that's called a semen analysis, looking at the count, the volume, the motility, those things can give you a general overview. And I feel like we do a lot of sugar coating
We do.
of sperm tests.
Yes.
A lot. So it's like, I hear this all the time. A couple will come in and I'll say, so what do you think your fertility factors are? And the guy will say, oh, my sperm's kind of slow, but otherwise it's really good.
Right.
Well, if it's slow, it's slow. That could be the fertility factor. So why are we sugarcoating it? Let's talk about what can we do to make it even better. Because unlike egg quality, I mean, you can take supplements, take really good care of yourself and be healthy, but at the end of the day, we run out of eggs. But guys, you're always making new sperm. There are things that you can do that can both negatively and positively impact your sperm quality. Supplements, seeing a urologist, don't cook your balls. I did just say that. We used to give out shot glasses that said that. We ran out. You can't get them anymore.
Yeah. Limited edition.
Limited edition only. We'll have a t-shirt with that next time. Okay. So as far as the basic semen analysis.
Right.
And then there's the advanced sperm test.
Right. Which speaks to the integrity of the sperm.
Exactly. So looking at the
sperm.
DNA. Right? So, I mean, there are guys that say things like, oh, I have a 5 or 6-year-old and a 10-year-old, it's not me. Well, we don't want to say who it's about. We just want to solve the problem, put you through a cycle, find out what's going on, give you the best chance of pregnancy.
The goal.
And
a baby.
A baby, exactly.
Expanding your family.
Exactly. So with advanced sperm tests, we can do the DNA fragmentation. You can also look at fertility genes as well.
Yes.
So that's kind of the sperm stuff, so to speak. And then there's the whole anatomy factor, like the fallopian tubes.
Yes. Are the highways open?
Yes. Right. Is the embryo freeway wide open? And that's kind of what do we talk about it. Lover's lane. So let's dispel some myths about the fallopian tubes. So some people think that you need to have, or I should say that if you're having regular cycles, your fallopian tubes are open. Right. Myth. That's not true. So your fallopian tubes do not have to be open to have regular periods. It means nothing. An egg, I mean, when we should have an egg here to show, I mean, an egg is not this big. No. An egg is microscopic. You can't see it with the naked eye. So in order for an egg and sperm cell to meet one another and, really meet, you know what I mean, they meet in the fallopian tube. And then the embryo travels down the fallopian tube for approximately 2 to 3 days until it sticks and grows in the uterus, and that's where it hatches and attaches. Okay?
So that's why a slow swimmer is really important to diagnose.
Right, exactly.
That sperm microscopic cell has to get up to lover's lane.
Right. Yeah. If it's slow, it won't do that. So if you know that you have slow swimmers, there are things that you can do to make them faster. Give them a little coffee. That's a joke. Doesn't work.
Watch lots of Michael Phelps.
Lots of Michael Phelps. Fallopian tubes. So how do we address fallopian tubes?
You do an SIS, water ultrasound, or HSG.
So you can do it under imaging studies. There are 2. The saline infusion sonogram for tubal patency, that's one way, and the other one is the hysterosalpingogram. So the hysterosalpingogram is like a fancy x-ray. Right. So if you've Googled even a little bit, just a little bit, you know that these tests can be described as the most painful test that you can ever have or ever experience in your life. But that's not what we do to people. No. So we offer everybody Tylenol with codeine. Yes, it is that painful that you need codeine. And a Valium 30 minutes before, as well as antibiotics and a driver. So you don't want to go there loopy and not have someone be there with you and drive. So you don't do that. So that's kind of how we set it up. And sometimes you just get pregnant from doing that test. I mean, there might be a treatment benefit. There's definitely a diagnostic benefit. So there might be some therapeutic benefit from doing the test. And then you might have a higher chance of pregnancy, maybe within 3 to 6 months of the fallopian tube test. I mean, surely we've had patients who've just done that test and they got pregnant that cycle. So that's another myth that people think that if they do the HSG that somehow they have to, hold off on getting pregnant for a certain period of time. But that's not true at all. So those are the 3 things. I mean, we addressed eggs. We talked about sperm. We talked about fallopian tubes. So if you have an idea as to what's going on, then the next question to ask yourselves is this: how many kids do you want? We are very greedy, extremely greedy. We want everyone to reach their goals and have as many kids as they want. We do. We don't want you to get pregnant now. I know it's hard when you're having a hard time getting pregnant to even think of having more kids. Right. But we want you to have the family size of your dreams, okay? So if you know how many kids you want and you know your fertility diagnosis, we want you to talk to your fertility specialist about your goals so they can gear your treatment around that. I mean, believe it or not, I have patients who came to me, almost 10 years ago and said, Amy, I want 4 kids. And so with the fertility levels that the family that I'm thinking right now, that they had, we went through and did enough IVF cycles so that they could have the number of members that they need for 4 kids, and they're on baby number. They've already completed 3.
This is probably
of
the
the
only instance
pregnancies.
you would put all your eggs in one basket.
Yes, no
right?
pun intended.
No
That
pun
is true.
intended.
That is true. Yeah, that's a whole nother discussion for another day. Is how many embryos, and the the right age and what the recommendations are. So as far as fertility treatment and the different treatments that you can consider, so one of them is fertility pills, right? And so there are different fertility pills that a lot of patients take. So Clomid, I say if you're going to use Clomid, you should schedule your exorcism very soon after, right?
Yes.
So
Side effects of Clomid.
yeah, hot flashes, mood changes, bloating, depression.
Then can thin your lining.
Yeah, and the severe headaches. If you already have depression or a history of migraines, we don't recommend Clomid. We like to use another medication called letrozole, also known as Femara. It's in the system only 2 days. It's gentler on your system. It can cause some lower leg cramps, and very rarely patients will still have the hot flashes and mood changes, but it's much better tolerated than Clomid, don't you think?
Yes, much better tolerated.
And then you can, put that together with
injections.
Injections too. Right. So when you take a fertility pill, you'll ovulate maybe like 1.6 eggs. So sometimes it's 1, sometimes it's 2. But if you're that person that wants to ovulate more eggs, because let's say there's a sperm issue and you need to present more eggs to the sperm to give yourself a better chance of pregnancy, then you could consider adding a low-dose fertility shot as well. Right. And then you can also do an IUI. So that stands for intrauterine insemination. If you think of a turkey baster, no, that's not what we do in the office. No. It's a very small catheter.
Yes.
Okay. You just collect. You can collect at home. Every center is a little bit different about their rules about IUI. I have a funny thing. Flow and go.
Flow and go.
You just flow and go. So you got the cup. You're at home. You just bring it in. So if you live within 30 minutes, that's cool.
Flow and go.
But you don't keep it cool. You keep it nice and warm. We should make like a Snuggie for a sperm cup.
That's a great idea.
Isn't that a great idea?
You should put a pocket in here.
Yes.
And you just put it right in there.
Right.
Snuggie
Keep it warm.
For your sperm.
Snuggie for your sperm.
They have it for beer.
We should
Why
see
not?
if there's a URL already
Yes,
for
yes.
that. Snuggie for
Coming
your sperm. Coming
close.
soon.
Coming
Okay.
soon.
A new shirt.
Yes.
Or a bumper sticker.
Maybe.
Or a mug. Okay. So you've done the IUIs, and the most frustrating thing about IUIs are they don't work.
Yes, it's very frustrating.
Super
frustrating. You think 1
frustrating.
+ 1 should equal baby.
Yeah, and especially when all your friends are getting pregnant and you're not, especially if you're, let's say, under 35, there are reasons why IUIs may not work, and it has nothing to do with you. It has to do with the sperm's ability to fertilize the egg, or everything. Literally, that spark of life has to be like absolutely perfect. In order for a pregnancy. It's very complex. Yeah. So people are surprised when they ask me, what are my chances of pregnancy with IUI? And I say 10 to 15%. And they look at me like, only 10 to 15%? And I say, yes, we're human beings. We're not like cats and mice or bunnies.
Rabbits.
Rabbits.
Yeah.
No. If only. Yeah. If only. So you don't have to go through, a certain number of IUIs, then to go to IVF. Right? I mean, there's this misconception. It's kind of old school thinking that you have to do 6 of this, 3 of this, 3 of this before you can go to that. I mean, for us, it's what's the fertility diagnosis? I mean, if the diagnosis is the egg supply is low, well, then do the treatment that you feel most comfortable with. So one of the things we will say all the time is be as aggressive as you feel comfortable being. And aggressive is different to different people. So for some people, aggressive is just coming in and saying hi to us. They just want to explore their options, kind of see what their options are. For other people, aggressive is taking fertility pills. And then for other people, they want to bypass all that and they want to just go right to IVF. And you can do that, especially if you want, a certain number of children.
Right.
Right? So as far as IVF goes, IVF stands for is very fun. No. We try and make it fun.
We try.
We
do
try.
our best. I think we do it.
I think we do a good job. We do. But at the end of the day, we know that it is an emotional roller coaster. And we try and make the process as simple as possible. I mean, you hear all these horrible stories of people taking like 120 injections just for a cycle. They're like human pincushions.
Yes.
The amount of time that it takes out of their life. But we design protocols so that, you're taking basically as close to 1 shot a day as possible. Skin of your tummy, nothing in your butt in our office.
Yet.
I don't hear anyone laughing.
No.
We should have a laugh track behind us.
We should have a laugh
because that was
track.
funny.
That was really funny.
That was really funny. Yes. So skin of your tummy every day. about 10 nights, just kind of depends on when we get your maximum awesomeness of eggs grown. And we watch you on ultrasound during that process. And then the egg retrieval, it sounds also scary because it's a surgery in your sleep. And honestly, like, people are scared of two things. When you say IVF, it's the needles. And anesthesia. Everyone thinks that they're not going to wake up after it, but it's really a gentle form of anesthesia. I mean, of course, it's a surgery and there are risks with everything.
Right.
But, you know, the risks are less than 1% with a procedure like this. And everyone wakes up always. And they always wake up saying, have you started yet? And that's really fun to say. We've not only started, but we're done.
Right.
And then if you're in a heterosexual relationship, your partner, most likely, depending on the situation, would be collecting in the sexy room. It's not that sexy. In the collection room, producing his sample while you're in the egg retrieval room. Flowing and going. Yeah. And then he will join you in the recovery room. And in the recovery room, you guys will hang out for about 45 minutes until you go home. And then the next morning, we give you embryology reports. You'll find out how many embryos you have, how they look over time, their quality, how many cells each embryo has. And we tell you everything. Always. We want you to know exactly what we know in real time. And it feels like a numbers game, though, you know, because patients, they see their follicles and they see, let's say, 20 follicles. And then all of a sudden there's, 12 eggs and then 10 embryos and then 6 blastocysts and 2 are normal. And it's like, what's happening? But we turn that around and we say, it's human biology. I only expect about 2 really high quality genetically normal embryos for someone of your age. So then you're kind of programmed differently because we're just so used to the school system. It's like 100%. You have to score 100.
You want to get all of those eggs.
All of those eggs. And, if there's 11 eggs, that means 11 babies. But that's just not how IVF works. And so that's just something that we want, people to know from the very, very beginning of their cycle. And then there's all these things that you can do within an IVF cycle to give yourself the best chance of pregnancy. Right. So if the sperm is low or, the motility is low, one of the things that you could do is ICSI.
ICSI with an IVF. That's the matchmaking process.
Yes. So you just pick up a sperm cell and you put it directly into the egg. The other term for that is ICSI, intracytoplasmic sperm injection.
Right.
And then you can also do PICSI with ICSI or ICSI with PICSI. And that's a really cute little fairy that flies over the petri dish. It is not. It's a special dish coated with a special substance that's sticky, hyaluronic acid, and the sperm cells just bind to that are genetically normal. And it kind of gives you that, depending on your situation and the DNA fragmentation, an extra head start.
Right.
Or jump start.
Screening out maybe the healthier swimmers.
Yeah, totally. And then you can also do genetic testing of your embryos, and we call that the murky IVF crystal ball.
Murky, yes.
Right?
Cloudy with a chance of pregnancy.
Exactly,
yes.
Exactly. So, we thought when genetic testing of embryos came to as a scientific breakthrough that it was going to be everything, that all of a sudden everybody's going to be getting pregnant, and then we learned soon that that's not the case. So genetic testing is the closest thing to a crystal ball that you can get. You can find out if an embryo has a normal set of chromosomes, but it doesn't mean and everything else is normal with it, like other genes, like implantation genes, that will result in a healthy pregnancy. So we like genetic testing companies that give us a mitochondrial DNA score as well, because that kind of quantifies what the implantation rate would be per embryo. Because patients ask me all the time, like, what are my chances with IVF? And I say, well, for all comers at your age, this is the approximate chance. But once I've actually done your cycle for you, I can look at the beauty of your embryo. We can look at the mitoscore, put it all together, and come up with a rate for you. So you kind of have a good idea as to how you want to plan things for the future.
Right.
And then once your embryos are made, right, so there are other things that we want patients to do. So we want to make sure that they also pay really close attention to implantation factors.
Yes.
So we don't just want to plan for the very best IVF cycle for you. We also want to plan for the most ideal implantation scenario. And we do mock cycles. We, consider tests like the receptivity assay and other tests looking at BCL6 levels and markers for endometriosis and fertility gene tests before we even transfer. So I don't know if there are people that want to call in and talk to us live. So we're ready to take the first caller.
Wonderful. And I see that we have Miriam from Walnut Creek. I'm going to bring you online with Dr. Amy.
Hi, Miriam. Hi, Miriam. Can you hear us?
We can hear you.
Hello.
Hi. I'm just listening in.
Oh, thank you, Miriam, for listening. You're our first on-air caller.
High five.
High five. Virtual high five. We should high five each other. Okay, Miriam, that's for you. Well, thank you. Thanks for listening.
Thanks, Miriam. And I have another caller from Miami, Florida.
Oh,
Miami, Florida. Okay.
Hello.
Welcome, Miami. How's the weather?
You're on air.
Hello.
Hello, Miami. Can you hear us?
Yeah, hi, this is Nimisha. Can you hear me now?
Oh, hi, Namisha.
Hi.
I think you are our success story for the night.
Oh.
Yes. So
Yeah,
yes. So we want to end.
Are we?
You are live on YouTube right now and being live streamed on Facebook. So you're going to be our last caller and our first shared success story. So Namisha, tell me, how old were you when you started trying to get pregnant?
I would say 30, 31.
30,
Yeah.
31.
About 30, 31 year of age. Fairly
Okay.
young enough, not that old.
Okay.
I'm sorry, but yeah.
And how long had you been trying until you were successful?
What to say about this? I think about 6 to 8 months that I tried on my own, and that was not quite successful. That's the time where we started looking around. Went to the doctor's first, the OB-GYN.
Okay. So
They did our regular.
So after 6 months, you were proactive enough to think that you should go see somebody. So what made you think after 6 months, because most people would wait a year. So why after 6 months did you say, I should go see somebody, and you went to see your OB-GYN?
That's a very good question. Actually, I had a history, or I would say about 5 years ago, I had my labs done. Some of the FSH and LH and AMH hormones, not AMH in that time, but FSH and LH, those tests were done, and those tests had come about 20, 25 numbers.
Okay.
And my periods were on and off, irregular, like they were generally coming on, but I would just all of a sudden just skip them, and then I would have to go medically intervene and start my cycles again.
Got it.
So there was something in my mind that would tell me, okay, if I don't get pregnant when I'm actually trying, and given our background of science, like I'm a biotech scientist, my husband is also from the same field. So trying was a genuine trying, where you know your menstrual cycles, where you know your signs, and you know what it takes for you to get pregnant.
Right.
And then when it doesn't work, that's the time when you go to doctors. And so I tried in probably 6 to 8 months, I went to doctors.
Okay. And so what kind of treatments did you start? What did you do first?
So first was going to the OB-GYN, who looked at my regular hormone levels, and they said that the hormones again look bad. Of course, FSH was 20 and AMH was undetectable. So again, my age was 32. Probably that was, you could call those levels you don't even see in 40-year-old or even older patients. But in my case, it was AMH levels were undetectable. My AFC count was 1 or 2, and FSH levels of about 20, 25 in few consecutive cycles. That's what they directed me to the fertility center.
Okay.
And they also told me that we are not sure if there can be pregnancy with your own eggs given your history.
Mm-hmm. So what kind of treatments did you start with?
So the treatments they asked us first was Clomid IUI,
Okay.
1 or 2 cycles. Those were not very successful, and meanwhile, since I'm a scientist, I also started deep diving into things.
Okay.
They made me feel that probably those are not the right treatment approach, given I kind of gauged what was going on with me, which clearly we all know now it is a diminishing ovarian supply. You do not have much eggs left, and you do not want to start with something as simple as that. So then you look around and try to look for other doctors, or maybe look for second opinions.
Right. Right. So then what led to your success? Tell us about that.
What led to my success?
Yes.
First, looking around, going for doctors. So where I found your name, Dr. Amy, lightning as a Christmas light in the Google, wherever you find her. So then you say, okay, probably this is the time. Let me just go find her and see how the experience is. So first couple of meetings, it was very encouraging, very informative.
Yeah.
And that made me go to her. We started doing some injectables. I would say a couple of IUI cycles with some shots, FSH and menopause, and those few cycles that we tried with mid-stimulation doses.
Right.
Those are not as successful, of course. Couple of follicles that I would get every time. And meanwhile, I also started doing a lot of acupuncture and acupressure and some of the other supplements that would help with my egg quality and improving the lifestyle.
Right. Right. And so tell us your success story. What ultimately happened?
So ultimately, I think after a couple of IUI cycles with Dr. Amy, of course with you, And we went for a third IUI where my 1 or 2 AFC count were looking at number 5 by day 1 or day 2 basal count.
Yes.
So that seemed like probably it could be a promising cycle. And during this phase of about 4 to 5 months of trying to be more proactive and trying to get more, trying to conceive, I think our SSH levels were also down from 20 to 6.5-ish in that cycle.
Yes.
And that made us really hopeful, thinking that probably this could be a cycle. So we just started, we were looking at the cycle, and it was an unplanned IVF, or the IUI cycle that was converted into an IVF.
Yes.
We retrieved 2 eggs.
Yes.
Both were mature, lucky enough.
Yes, golden
and
eggs.
They both got converted in the embryos.
Yes.
And I was given 2 embryo transfer, and I got pregnant with twins.
Wonderful.
It's amazing.
I love it.
Best story ever.
Yeah, so not very many doctors would want to do the IVF with such profile, with such low reserve.
Yeah.
I was lucky enough to have found you, and I was pregnant. Yes, with my own eggs, of course.
Well, thank you for sharing your story. So I have to ask you a question. Is there anything that you would tell women who, let's say, are in your position now that you were in, let's say, 4 years ago? What would you want them to know? Like, what do you want them to know?
I would say first thing is, of course, keep track of your levels. Be more fertile, aware of yourself. These talks were not that open when we were earlier, like 4 or 5 years ago. Nobody used to talk about fertility and the women's hormone that often as we hear now. And this is despite the fact that I knew my levels 5 years ago when I was trying, and nobody ever explained us what it is. I think now the talks are more open, so be more fertile, aware. And while you are trying to conceive, things don't work, I think perseverance is the biggest virtue that takes you long way in your journey to get to your goals. So if you don't like the doctors, change the doctors, listen to your heart, be more proactive, and
persevere.
patient, like be your own advocate.
Right, persevere. Absolutely. Give them hell.
Yes.
Yeah. Okay, well, thank you, Namisha. Thanks for sharing your success story.
Namisha.
Thank you for everything.
Sure, my pleasure. Thank you.
Thank you for everything. So this will end our first live Egg Whisperer show. We'll be here every Wednesday, 6 p.m. Pacific Standard Time. You can call in. The number is on the website. Share your story with us. We're happy to answer your questions. And we'll be sharing a success story at the end of every show. Have a
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Vazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.